So, Anban, we've talked about this issue of harmonizing regulation of medicines, and uh, we've realized that the end goal is to promote access. So, in your opinion, how does regional harmonization promote access? Are there ways in which it can be done so that it promotes access more than just being a regulatory objective function?
Yeah, I think it's important that the regional harmonization strategy takes account of the medicines that require access in multiple markets and ensures that the agreed harmonization guidelines are linked to those types of medicines. I think very often the regional harmonization is usually linked to products which are financed by donor funding, which is helpful in terms of trying to identify which products and which standards need to be dealt with. I think it's important to also recognize that there are various dimensions to access, and the regulation of medicines or the regulatory aspect is one aspect of that. There are obviously other issues such as harmonization around the issues of availability, the financing, and the physical aspect and the quality of the medicine itself, then the storage and the like. But I suppose the purpose of this meeting is largely to focus on the matter of the regulation of the harmonization process, which is largely a regulatory function.
Thanks, Anban. And regional cooperation is not necessarily a new idea. The 2012 report from the National Academy of Medicine talked about it. However, it's hard to implement, as many of us recognize. So, in your opinion, are there activities within regional cooperation which are easier to do, activities which are harder? Any examples where you've seen regional collaboration work better, areas where it has been more challenging?
I think the aspects of regional cooperation require mutual interest from all of the countries that want to participate. So it needs to be a voluntary process. However, I think something that's often not discussed in a lot of detail is the established pharmaceutical industry in each of the countries that are considering regional harmonization. Particularly if one country in a particular region has a strong pharmaceutical manufacturing industry, and if the standards in the region are then going to be set based on the standards of that particular country, there is often a tension that exists within the regional arrangement, which would suggest that the country with the largest pharmaceutical industry would then become a net exporter of pharmaceuticals into other countries that may have standards which are not the same, and so those other countries could not export to the others. However, one country becomes dominant. So I think that's something to take into account when developing these regional guidelines and standards. Because one wants to avoid the issue of tension between countries, which that usually results in the regional harmonization not working very well. The obvious area to work jointly in is the evaluation, and the scientific aspects of the medicine evaluation lend itself to very easy collaboration between countries. However, aspects such as scheduling and the labeling of medicines and the storage and its use and indications may vary by region depending on disease burdens, practices, etc. And so those may be something that may be left to individual countries to decide on. And in doing so, I think it's important to understand that countries are more likely to align themselves to regional cooperation, particularly where individual countries have limited resources. And through the collective effort of the region, they're able to achieve greater efficiency in medicine registration, which consequently results in greater access to medicines.
Thank you, Anban. We may have follow-up questions on this from the committee, but we'll hold on for now and go to Lisa Inder.